MMT, shoulder abduction, middle deltoid and supraspinatus. Assist the patient to the short sitting position with the arms at the side. Stand behind the patient on the test side. Passively abduct the patient's shoulder to 90 degrees with the palm facing down. Support the arm by placing your hand under the elbow joint. Place your other hand over the clavicle to make sure there's no scapular elevation. You are not assessing the infield, you're determining how much range the patient is able to move the shoulder in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to abduct the shoulder to 90 degrees, keeping the palm facing down. Stabilize the patient at the opposite shoulder. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include leaning the trunk away from the test arm, moving the arm into external rotation to use the biceps to assist, and scapular elevation to give the illusion of abduction. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the opposite shoulder. Your other hand is contoured over the arm just proximal to the elbow joint. The resistance is applied in a downward direction toward the floor. Apply the force for a 5-second count. Grade 5, normal. The patient completes shoulder abduction to 90 degrees and holds against maximal resistance. Grade 4, good. The patient completes shoulder abduction to 90 degrees and holds against moderate to strong resistance. Grade 3, fair. The patient completes shoulder abduction to 90 degrees but does not tolerate any resistance. There is no position change for grade 2, 1, or 0. Grade 2, poor. The patient completes partial range of motion of shoulder abduction to 90 degrees. For grade 1, stand behind the patient, palpate the middle deltoid lateral to the acromial process on the superior aspect of the shoulder. Cradle the test arm by providing support at the elbow and raise the arm to 90 degrees of abduction. Instruct the patient to try to maintain the arm in this position. Grade 1, trace. Palpable contractile activity of the middle deltoid with no motion. Grade 0, no palpable contraction.